Willamette Partnership here in Oregon, and that's a big part of why I joined the Culture of Health Leaders program. And it's been a humbling experience. Imagine that we're going to be spending billions of dollars on our road, energy, and water infrastructure over the next few years. And think if we can really change how we do that in a way that's going to be advancing health and advancing health equity. And that's what our friends here at Willamette Partnership and with Oregon Public Health Institute are working on, is how do we make greener, healthier zip codes across the western United States.
Prior to starting the Robert Wood Johnson Foundation Health Policy Research Scholars Training and Networking Opportunities, my research approach only took my discipline into consideration. However, since joining HPRS program, I have been a part of cross-disciplinary collaborative group, including researchers from the fields of epidemiology, nutrition, social welfare, agriculture, education, psychology, just to mention a few. And we are working together in building a culture of health. Working in group to address the opioid epidemic, which is a prescription drug, and presenting group results during the Summer Institute was a big aha moment for me. The cross-disciplinary approach the Health Policy Research Scholars Program envisions for the scholars is helping me to make that connection. I am gaining better understanding of how health crosses many disciplines and shaping my thoughts with regards to how it takes multifaceted approach to truly begin to tackle health problems.
Hi, my name is Dr. Iran Barrera. Live in Fresno, California, originally from Avenal, California. The project that we are working on with our team is called Adverse Childhood Experiences, short for ACEs. And what we're looking at is what are the perceptions that parents have in Fresno Housing Authority and staff members. What are the perceptions regarding adverse childhood experiences? What are the health implications when the children are adults? So that's something that we're looking at in Fresno County. One of the things I think about being part of the IRL program is how it's allowed me to think critically in terms of looking for solutions, especially in areas of underserved communities. I think that the networking and the collaboration that the Robert Wood Johnson Foundation has really surprised me, and at the same time has really allowed me to come to work thinking about how is it that I can be a change agent to build a culture of health for these underserved communities. One of the things that I'm also very grateful for the Robert Wood Johnson Foundation is that I had never been to New York City, and as a result of being in the program, I was able, through collaborations with my other team members at Columbia, gone and saw what the New York City is all about. So for that, I'm very grateful. All in all, the program has really inspired me in terms of professional development. So for that, I'm very grateful.
So one way that I'm approaching my work differently, especially as an incoming professor at the University of Southern California, is to think about how the social determinants of health really impact what I perceived racism was, which was just more of a direct or a vicarious way of experiencing it for Black families. But by meeting people working in so many different sectors, I've seen how the environment, I've seen how the media, I've seen how even things like farming can really impact the ways in which Black families live and their wellness here in the United States. So I'm able to think more conceptually and more broadly about the ways in which racism, which is something that I thought I had a handle of in the psychological realm, and how that really looks in various fields. So I'm really grateful to my other leaders who are incredible experts who have showed me just how how cultural and determinants and social determinants really impact the ways in which the families who I work with live.
My research area is maternal and infant health, where my dissertation will focus on reducing breastfeeding disparities within the African American community through understanding social support and breastfeeding self-efficacy. Being a health policy research scholar has impacted my work differently because it has encouraged me to think about my work in a broader context and makes me think about how my research can translate into policy and practice. This opportunity has also bolstered my confidence to think outside the box when it comes to how my research can feed into the development of policy and support positive, meaningful change within our communities. If it were not for this program, I would not have had the opportunity to meet other students and my future colleagues that are like me with similar interests and backgrounds, giving us this space to think about how we can begin to make a meaningful change.
To me, the most surprising thing that I've learned throughout this program so far is just how minimal the collaboration often is between not only academia and the community, but also between academic departments. And so IRL has not only encouraged us to be more interdisciplinary and to collaborate much more extensively, they've also given us the tools to do so.
Now I not only have to think about how I can get my research into peer-reviewed journals, but I have to think on a wider perspective. How can this research actually have a policy implications?
I think one of the things I can say the most as a researcher is we're taught research methods and procedures, but not so much about how we can look at ways that our findings could then impact policy. So one of the experiences that I've found most useful so far, beyond getting to know other research teams and community leaders, but being afforded the opportunity to learn from people in the field who work on Capitol Hill, from policy analysts, from reporters. So really learning how to disseminate our findings to a broader audience so that we can have broader policy impact.
To blend the theories that I'm learning about here with the practice work that I've done in the past and that I will continue to do, and let those things come together so that we can influence policy from a both and approach. Usually, like, the academy writes amazing research that sometimes makes its way to policy, or people do amazing work on the ground, and some examples from those are sometimes taken to scale based on different policies. I'd like to see an approach that really just merges all of them, because we all have so much to learn from each other, and I feel like policy decisions should not be made without the research background, but researchers should not be producing research that does not reflect the reality that's on the ground. So it should be a cyclical and iterative process, and I think that as hard as that can be, that there's possibility for it through work like the work that our students are doing, where when there is a crisis, that information is constantly filtered back through the major organizations that are funding efforts on the ground. And also through use of digital technology. I think there are possibilities there for how we learn and share from each other across different divides, across fields, across disciplines. So I'm just interested in learning how we bridge all of those things.
So Bridge Housing, who's the community partner of this project, is in the process of redeveloping 7 public housing developments in San Francisco. This is part of a citywide effort. And what we're doing as a team is looking at how that renovation is impacting health behaviors, health care utilization, as well as some of the social effects of the renovation.
Our partner, Susan Neufeld at Bridge, took our team to Los Angeles to meet some people she's been working with down there. And so we had an opportunity to learn about community development, workforce development, social service supports in Watts in Los Angeles. And I felt that the team that we met down there provided me with a lot of different perspectives that are relevant to the work that we're doing in San Francisco, the sorts of structures and services that the residents can benefit from, also the policies that might get in the way of providing those services in the best way for the residents.
Because I'm the community member, I've never really thought of myself as a researcher. I've always been more focused, I've always been a consumer of research, but not necessarily an initiator of research. So for me, being in this community of other focused researchers has been very exciting for me, and it's changed the way I see myself and see my role in the organization. And what I've really learned is that I have an important role to play in translating research into practice and also using practice to inform research.
We've met phenomenal people throughout the first year of the IRL. Some of the researchers I've actually followed for many, many years, like Mindy Fullilove, who's one of my favorite. Number one, she's a great author. Number two, she's done some phenomenal research in terms of neighborhood redevelopment.